I recently watched the interview with Serena Williams a couple weeks ago, where she came out and described her experience with taking a GLP-1 medication. I thought her experience was really interesting and wanted to provide my professional opinion on what some of these aspects meant. So let's take a look at this together.
Yeah, well, I feel like a lot of people have been watching my health journey, and I always like to post pictures of me working out for years and years. I mean, it's what I do. And I really wanted to bring people along on this health journey because I feel like I started GLP-1s with Roe, and then I was like, you know what? People need to know about this because I feel like it's like a secret, or it's like, oh, it's a bad thing, or, you shouldn't do it, or, oh, it's taking a shortcut. And I want to tell, as an athlete, like literally a professional athlete, even playing professional sport and not being able, in particular after I had my kids, not being able to get my weight back to where I wanted it to be at a healthy place, no matter what I did. I mean, everything. And I'm not a person to take shortcuts. I'm a person that works really hard and harder than the next person. And so for me, it was really like,
Yeah, so this is a really great point here. A lot of people with obesity cannot get their weight down despite everything they're doing, whether it's a strict diet, rigorous exercise. Here's a professional athlete that couldn't get her weight down into normal. I don't know her specifics, but we're going to talk later about some medical complications that were coming because of her weight. So we call this informally the set point. And I talk about this with my patients. Everybody has a set point, and if you try to get below that, your body really fights it, puts out hormones and other signals to try to keep you at that level. And so even people who are doing what Serena is doing really can't get their weight down, and we don't understand all the reasons for this. But I see it in tons of patients.
Struggling with getting your body to where you wanted it to be, and this really felt like medicine for you. What wasn't working for you after the girls?
Yeah, so afterwards, everything. This was medicine for me. And so everything, like I would walk, I remember walking around in Paris for hours. And first of all, I love walking in Paris. Every day.
Okay, so more of that description of trying to get her weight down and not being able to do it, and her looking at this as medicine. So obviously we look at it as medicine too. I mean, we're using GLP-1 medications to treat obesity for people who cannot get their weight down below a healthy range with just their diet and exercise alone.
I think my body was just needed a GLP-1 to just, get back to where I needed to be. And like we were talking earlier, I've never felt better. Like I've just lighter and happier and just healthier, and I can move more. I can train more. There's so much more that I can do now.
You got to do what works for you and your body, and no one knows.
So I just want to let everybody know these medicines aren't right for everybody, and talk to your doctor for sure to make sure if this is a good fit. But for her, she has a really great response. We see this in a lot of people. They feel so much better when treating their obesity.
I just feel like, I was at the doctor's a couple of weeks ago, and she's like, your blood sugar levels look the best they've ever looked. This is where you need to be for your health. And, so it's really like an all-around holistic health view at how I look at myself personally. And so for me, that's what the medicine has been able to do.
So, okay, blood sugars, she mentioned in another spot that she did that she was actually pre-diabetic, which is crazy as a professional athlete, not being able to maintain your blood sugars in a normal range. But this is what happens with obesity. It causes numerous complications. So with the medication, she was able to get her blood sugars down in a normal range. There is a really interesting study on one of the medications called tirzepatide on diabetes prevention. And keep in mind, we've been trying to prevent diabetes for years. Medicare came out with a special program called the Diabetes Prevention Program. We've been trying to implement these diet and exercise recommendations for our patients. And definitely it helps, certainly helps. And we're able to prevent diabetes in a large number of people, but not everybody. So this study that came out on tirzepatide showed that this medication prevents 94% of diabetes over the course of 3 years. And in my experience, treating people for more than 3 years, we can prevent it long term. Now, we do see 6% of people, or some people in my experience, don't know the exact numbers, who do get diabetes despite this. But think about the 35 million people in America that have diabetes and the $400 billion price tag per year that it takes to take care of these patients, or that it takes to pay for their health care with diabetes. What this would mean for our society and our medical complications. Again, these medicines aren't right for everybody, but that's an astounding effect for people who really need it. So I hope that you think about these medications in a balanced way. They're not right for everybody. They can come with side effects. You need to talk about this with your doctor, see if it's right for you. But for the people who it's right for, they have astounding effects. If you want to hear more, subscribe to my channel. We'll be going over this in more depth in future videos and podcasts. And remember, obesity is treatable. We'll see you in the next video.